Welcome to On the Beat, everyone. I'm Troy Thompson. Joining me in the studio today is, of course, Dr. Pritchard from Plastic Surgeons of North Mississippi. Welcome to the show, my friend.
Glad to be here.
Okay, these last few interviews we've done questions that people may not want to ask you or feeling a little bit too embarrassed. And one of the things that I wanted to talk about was scar revision, because I know people out there, when they have surgeries or something may have gone wrong, they are left with a scar that could have been done a lot better. All right, because a scar's a scar.
Right.
It's unavoidable. You will all have one.
Even if you do your best job as a surgeon, sometimes that scar does not cooperate because that's their healing process.
Okay.
And you're different than everybody in this room and me.
All right. Well, let's talk a little bit about what we read as scar revision.
Okay.
What is that?
Well, you could have as an example, and on a tummy tuck when the incision's down low, I've had patients come in a year later,
Yes.
and they've loved their results, except the scar had shifted. Like their body, their texture in their skin had allowed it to drop some. So now I got this beautiful scar going across, and this is kind of migrated down a little bit.
Oh, okay.
Yeah, so that's when you talk about revision, because now I have to take that section out and elevate it back to where it was.
Interesting. So it is, we want everyone to know scar revision is more surgery?
Yes, it's more surgery.
Okay.
And it doesn't have to be extensive surgery.
Well, that's what I was about to
It can
say
be a
to
lot of time. It can be in office, under local, or maybe just a light sedative or something.
Okay.
Yeah.
Something I asked you in commercial break, and I'm going off track a little bit, but you said, Troy, there are so many creams now that are so great when it comes to scar revision. I thought that was hocus pocus.
No. If we get people on anti-scarring creams within 2 weeks of surgery.
Really?
Oh yes. Once I've got them pretty much healed up, we start it, and I run it for, and every doctor's different.
Okay.
I run mine for a good 6 months to a year. I have a lot of men who went a year because they're just overdoing it, but their scars are so tiny you can barely see them.
We heal a lot better.
Yeah, absolutely. I wanted to throw that
All
out.
the women at home are going, oh, shut up, Troy.
I was hoping you'd come out and say something like that.
All right. Now, we have heard also, I've read in magazines and also had men and women ask me about laser for scar revision. Where do you stand on that, and do you think it actually works?
It works to some degree, and I really think it's the scar that you're staring at.
Right.
Meaning each individual, because if it's a real thick, hard scar, you're better off surgically revising it.
Gotcha.
Versus one, it's, just, it's got too much redness in it, and it's kind of softened, but it won't disappear. And then that's where laser really does work.
Okay.
Yeah, we've had some success with that.
Okay. All right. So I've had a tummy tuck or a breast implant, and I noticed in about 6 months my scar's not looking too good. Right. Is that when I come in and see you to have the consultation, or am I booking scar revision immediately? What's the timing?
You want to go 9 months to 12 months out. Yeah, well, the scar healing goes on for 18 months.
Okay.
So you want to get close to the 12-month mark before you do this revision. You want the maturity of the scar as much as possible, because you don't want to put immature scar on immature scar like a cut and it forms again, because I can't control that.
I got you.
Yeah.
What is keloid?
Keloid is a overabundance of scar tissue. It's scar gone wild. I mean, most of the time you see a little mounding at the scar, right? And that's normal, and you expect it to level out. Well, this goes outside the bounds of the scar.
Fixable?
Fixable. You've seen keloids on ears.
Yes.
It's big, thick. That's what that is. It's just massive.
How rare is that?
It's not rare.
It's
it happens.
Not rare.
No. But they are surgically revisable.
I had a girlfriend that had an implant, and she got keloid like no tomorrow.
Oh, I know.
And it just, she just wouldn't stop crying. She got it fixed, but again, it's something you need to talk to your plastic surgeon about.
Sometimes it's a staged surgery.
So we appreciate you. If you want to find out more, there it all is up on the screen for you. Dr. Pritchard of Plastic Surgery of North Mississippi. Back after this short break.